Hi, so this is lesson number 2 for ITL Guatemala. And in this lesson, I'm going to discuss dysmenorrhea. I'm going to talk about the two kinds of dysmenorrhea there are, but I'm going to specifically look at primary dysmenorrhea and how we could treat it. And this is a silly quote, but I thought, well, I think a lot of women can relate to this. Maybe if period pain burnt calories, it would be worth it. It's anonymous. So, what is dysmenorrhea? It's a medical term for painful cramps, and it starts in just before or during the menstrual period. Some women have it so badly that they cannot function, and there are two kinds of dysmenorrhea. One is primary, and one is secondary, and I'll talk about them both, but I'm going to discuss mainly the primary dysmenorrhea. It can be so extreme sometimes that women cannot function. They cannot work, they cannot study, they can't do anything. And I've treated many young girls and women in the practice with dysmenorrhea, and it is treatable, both primary and secondary. When I was studying Chinese medicine, I had, on my first day, I was sitting next to somebody who has become one of my best friends and a really good colleague. And starting up with the lesson, I was looking forward at the lecture, really excited, get going, and I saw out of the corner of my eye this woman sitting next to me just pass out, fall off her chair. And what it was is that she had so much pain and had such bad secondary dysmenorrhea that she just passed out from the pain. Long story short, she's become a naturopath and a Chinese medicine practitioner, and therefore no longer has those symptoms, but it can be really extreme. So it's just another name for menstrual cramps, and as I said, it can be bad, really mild or severe, and it starts usually within the first year that a woman starts, or a girl starts her period. That's called menarche. And we can look at the treatments for primary dysmenorrhea, and the allopathic side, so the medical side, painkillers or non-steroidal anti-inflammatory drugs. So aspirin, which is the non-steroidal anti-inflammatory, or Tylenol, paracetamol, ibuprofen. And they will sometimes suggest antispasmodics, so hyoscine or buscopan. Those are the two makes that I know and that I've heard of and worked with, that they work with either here in the Netherlands or in South Africa where I work. And then the complementary alternative therapies are working with supplements, working with warmth, which of course allopathic also does mention, exercise, herbs, vitamins and minerals, which are the supplements, acupuncture, reduction of stress, and dietary changes. So let's start with supplements. One of the big supplements that makes a huge difference with dysmenorrhea is omega-3, which is your fish oil. It's also in flaxseed, but in a different form and more difficult to synthesize into the DHA, which is what we need our bodies to make to be able to use it in our bodies. It's in fatty fish, salmon, sardines, tuna, mackerel, which is not on that list, but it's also in flax seeds and pumpkin seeds. And why does it work is that one of the reasons for the pain of menstruation is that the body makes prostaglandins, which are a reaction to inflammation in the body. It's part of something called the eicosanoid metabolism, and two branches. One branch are the omega-3s, and the other branch are the omega-6 and 9. And on the 6 and 9 side are the prostaglandins, which cause the cramping. And on the other side, to just be very simple, I can give you a whole lesson about this, but on the other side, the omega-3s are the good prostaglandins, which are anti-inflammatory and antispasmodic. And really, hundreds, thousands of studies have shown that supplementation with omega-3 can effectively alleviate symptoms from dysmenorrhea, like the lower back and the lower abdomen pain. It really, I've got so many research papers on that, and you can type it in and find thousands of research papers on pain, dysmenorrhea pain, and omega-3s. So another thing are changing your lifestyle and therapies. And one of the simple lifestyle change things is that you can use a hot water bottle or a pad. In America, I know I used to buy them when I was in America, when I was studying, are these pads you can stick on for your lower back or for your abdomen to keep too warm. It's one of those, once you open them, they stay warm. And or a hot water bottle. The warmth, basically what it does is it relaxes, and so stops those muscles from contracting, and also painfully, and it improves blood flow, because the reason that it's painful is that it restricts blood flow, and restricting blood flow causes pain. Acupuncture. Okay. Years and years and years and years I've tried, thousands of years, have shown that it works for pain. Acupuncture works for pain. And then recent systematic reviews of randomized controlled trials, have found that acupuncture and acupressure are very effective for primary dysmenorrhea, and actually for secondary as well. I work a lot with secondary dysmenorrhea as well in my practice. Significantly more so than pharmacological treatments, which is interesting. Exercise will increase your endorphins, and therefore a minimum of 15 minutes of exercise a day will help women with dysmenorrhea. I'm just checking my time here. I need to do these lessons in 15-minute blocks, otherwise they won't be uploaded, and so I keep an eye on the time. I'll be splitting this up into 3 blocks, I think. So aromatherapy and massage put together makes a very good therapy. So not just the massage, which will increase the endorphins and relax the muscles, but add aromatherapy to that, and it's fantastic for menstrual pain. So lavender rose, clary sage, especially for women who are having menstrual pain, and clary sage we use later on again during labor. We'll talk about that. Chiropractic care. There's a very specific protocol that chiropractors use to relieve the pain of dysmenorrhea. The Mayan abdominal massage, and girls, you're going to learn this, is fantastic for fertility, but absolutely brilliant for dysmenorrhea. It's very specifically used for women with painful periods. So you are going to be learning this, and when you learn it, keep that in mind, that this is one of the things that you will be using it for. Herbs. So you're going to get a whole lecture on herbs from me and what you use them for. But herbs for painful menstruation are the crab bark, which is so spectacular. It's also called squaw vine, and it's really been used for a long time to treat period pains. It's got a substance in it called scapoletin, and scapoletin is a kind of a muscle relaxant, and it tends to really work on spasmodic muscle contractions, which is what menstrual pains are. It's not a menstrual pain, kind of can be sort of there all the time, but mostly it gets worse and then gets better and gets worse and gets better, like contractions or rushes when women are birthing. So the dosages here, it's about a half a teaspoon every 2 to 3, it's a half a tablespoon, not a teaspoon, sorry, every 2 to 3 hours, when that's during the painful dysmenorrhea. So you just keep taking it every 2 or 3 hours, half a tablespoon. Then there's black caharsh, specifically the Semicifuga racemosa, which is very effective in helping to relax that uterus. there are many, many trials proven that the black cohosh works to relax the uterus. And this is a half a tablespoon to a quarter to a half a tablespoon every 2 to 4 hours. And what I normally do is I give a tincture mixed. And if you're worried about what half a tablespoon is, it's about 20 drops, 20 to 30 drops I do of each into a tablespoon. And that's generally about a half a tablespoon. So I'm going to stop there. There are more. There's more, much, much more, but I have to stop because of the 15-minute slots, and I think I'm about on 14. And I'll see you back in part 2. Thank you.